then you'll find the complications and the deaths in the infants will continue to grow. You can see here the children are vaccinated and they have vaccinated-induced protection from them. Adolescents have a very waning immunity. Adults and elderly have a limited immunity. Maternal immunization can help to protect the very young infants. The several vaccines have been found to be generally well tolerated and immunogenic in pregnant women and their neonates. Some vaccines are routinely recommended during pregnancy, including inactivated influenza. How many of you are using in your practice? Only those people who are using flu vaccination in their practice. Again, I can see 5-6 hands. Tdap. What is the Tdap vaccination? It consists of tetanus toxoid. It consists of diphtheria toxoid. It consists of pertussis, FHA, and again, these diphtheria, tetanus, and pertussis antigens are in reduced amounts compared to the pediatric vaccine because you do not require that kind of an amount at this particular time. A single 5.5 ml dose of vaccine is recommended from the age of 4 years onwards. Boostrix should be administered in accordance with official recommendations and or local practices regarding the use of Tdap vaccine. Boostrix is given deep intramuscular injections in the deltoid region. The use of Boostrix may be considered during third trimester of pregnancy. The human data from prospective clinical studies on the use of Boostrix during the first and second trimester of pregnancy is not available. It is not expected that the vaccination with Boostrix harms the fetus at any trimester of pregnancy. The benefit versus the risk of administering Boostrix during pregnancy should be carefully evaluated. Limited data indicates that maternal antibodies may reduce the magnitude of the immune response to some vaccine in infants born from mothers vaccinated with Boostrix during pregnancy. The clinical relevance of observations are unknown. Now, what is the available evidence on the safety of Boostrix in maternal immunization? Boostrix is the brand of GSK, otherwise it is called Tdap. This is a special acknowledgement to GSK because they have hosted lunch for you people for a great Women's Day. The largest number of pregnancy exposure and prospective observational study with Boostrix that have been actively followed up for safety outcomes. 793 participants, the mean age had been 32, with 62% of participants aged between 25 and 35 years. The vaccination with Boostrix in pregnant women was well tolerated, with no serious adverse events following immunization. This is reassuring for pregnant women, vaccinators, and for policymakers that this particular vaccination is safe in pregnancy. Again, taking the safety of Boostrix forward, retrospective cohort study of a pregnant woman using vaccine safety again has been analyzed from 2007 to 2015. Among 36,000 pregnancies in which Tdap and a flu vaccinations were given together concomitantly in nearly 23% of patients and sequentially in about 77% of patients. No statistically significant increase in risk of fever or any medically attendant abnormal reaction was found in pregnant women vaccinated concomitantly, both for flu and for Tdap. No difference in preterm delivery, low birth weight, or small for late gestational age neonates between women vaccinated concomitantly compared with sequentially in pregnancy. There's more evidence supports that this particular vaccine is generally well tolerated. Tdap vaccine safely cohort includes nearly 55 vaccinated pregnant women. Again, there was no increased risk for any specified maternal safety outcomes within 42 days of vaccination. A cohort including 1,229 women who received Tdap vaccine more than once in a consecutive pregnancies, again they found there had been no problems. Then there is a data which is going into crores, again where the pregnancies have been administered. Both vaccines demonstrated suitable safety profile, no serious adverse effects or fatalities have been reported. What are the recommendations about Tdap? As per the FOXI Your Body of 36,000 gynecologists, says that Tdap vaccination can be considered instead of second dose of tetanus toxoid to offer protection against diphtheria and pertussis in addition to tetanus. Tdap should be administered in the second half of the cycle, second half of the pregnancy. As far as IAP is concerned, one dose of Tdap vaccination to be given in the second half of pregnancy between 27 to 36 weeks. Now these are the countries where it has been followed very actively. So coming to the final summary, maternal immunization with Tdap vaccination, newborns are too young to be protected by currently available vaccination schedule. So the mother has to be given in the second half of the pregnancy. The use of boostrix may be considered during the third trimester of pregnancy. The boostrix in the third trimester have been shown no vaccine-related adverse effects on pregnancy or on the health of the fetus or the newborn child. Maternal immunization is recommended by several authorities, including any guidelines which you follow, including FOXI and IAP. Thank you very much. How to report any adverse event? Report within 24 hours of your awareness of any adverse event following immunization has to be reported on this particular website, and you can do that. So that's it.